This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch Wisconsin Eye on Spectrum Channels 995 and 363 and at wiseye.org.
Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's briefing are Governor Tony Evers and DHS Secretary-designee Andrea. Also available to answer questions are Traci DeSalvo, the Acting Director of the DHS Bureau of Communicable Diseases, and Ryan Nilsestuen, the Chief Legal Counsel in the Office of the Governor. We begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everybody, and thank you for joining us today. Some of the most meaningful moments in my life happened in the classroom. From my time as a teacher, a principal superintendent, and state superintendent, to meeting my wife, Kathy, in Ms. Potter's kindergarten class. I'm also a grandparent of 9 grandchildren, some of whom are trying to navigate this new normal and the challenges of the school year ahead. So I want to be clear. I know this isn't easy, not for parents like my own kids, our educators, school staff, and administrators, and especially not for our students. Although this school year may be different than in years past, one thing certainly hasn't changed. And that's how our educators will go above and beyond to strive to get our students the best education safely, no matter where they are. They know, as I do, that what's best for our kids is best for our state. And we share a commitment to ensuring every Wisconsin child has access to a quality education. In these difficult times, we need everyone to do their part because our schools are the hearts of our communities, and the health and safety of every staff member, educator, and student is critical to the health and safety of every community. That's why the Wisconsin Department of Health Services released school guidance this week to help local and tribal health departments and school districts prevent, investigate, and control COVID-19 outbreaks in our K-12 schools. This builds upon the guidance the department, along with the Department of Public Instruction, released earlier this summer. As I have said all along, when it comes to our schools, our educators, local administrators, and school board members are best suited to make the decisions for their school district based on building capacity, student needs, available resources such as internet service, and special education services. We want to ensure we are providing them with every tool available so that they can be prepared when outbreaks occur, so that they can act quickly to identify symptoms, address cases, and prevent further spread. Education, health, and safety all go hand in hand, and that's why it's important this pandemic has made school this fall such a complicated issue. Whether it's in-person instruction or virtual learning, I know we can rise to the challenges in front of us, even if it's a little bumpy. We can make this school year a success if we all keep working together to best serve our kids. As long as we keep our kids' well-being in mind, we will move forward in the right direction. Wisconsinites are resilient, and we will get through this by looking out for each other, our families, and our neighbors. So here's what we need to do, folks. Please continue wearing your mask or face covering whenever you're out in public. Remember, my face mask protects you, and your face mask protects me. And everyone is better off when we wear them together. Continue to practice physical distancing. Avoid large gatherings. Keep your social circle small. And stay home when you're able to. And get tested right away and isolate yourself from others if you start to experience any symptoms. Finally, hold fast on our tried and true shared Wisconsin values. Practice empathy, respect, kindness, and compassion, and I know we will get through this together. So I'd like now to pass things over to Secretary-designee Andrea Palm for her updates. Andrea?
Thanks, Governor. Good afternoon, everyone, and thanks for joining us again. I'll start today with today's numbers. So here's where we stand. We have 1,103,038 people who've tested negative so far, which is an increase of 9,744 over yesterday. And there are now 69,059 confirmed cases of COVID-19 here in Wisconsin, which is an increase of 826 over yesterday. Our death toll has now reached 1,068. These are always difficult numbers to hear because they represent people who are our friends and our neighbors. I want to express my appreciation to all of you for you doing your part to help stop the spread and reduce further infection and deaths. But we do continue to see high disease activity levels here in Wisconsin. So as we look forward to a beautiful weekend, I want to revisit the individual decision tool that we announced earlier this week. The tool, which you can find on our COVID-19 webpage, is designed to empower you to make safer decisions about your activities. The tool provides a series of questions to help inform your thinking, taking into account potential impacts on your family, friends, and your community at large. As we've said before, the safest choice is still to stay home and to limit your trips to the essentials. But we understand that doing this is difficult. So we encourage you to use the individual decision tool to make safer and well-informed decisions. Like, for example, visiting a state park instead of a large gathering, or enjoying a drink on your back porch instead of going to a crowded bar. And remember, if you go out in public, you need to wear a face covering. By wearing a face covering, you protect me and I protect you. Thanks again, Wisconsin, for doing your part to help stop the spread of COVID-19.
And thank you. We will now take your questions. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. And we'll begin this afternoon with Adam Rogan from the Journal-Times in Racine. Adam? Okay, we'll move on then to Scott Bauer of the Associated Press.
Hi, thanks for doing this call yet again. Governor, I wanted to ask you what your take was on the UW budget request that was approved by the regents yesterday. Are you on board with their roughly $96 million spending increase request?
I had a chance to talk to Governor Thompson 2 days ago, I think the day before it went to the Board of Regents, and we had a good discussion about it. We're looking forward to the details. Details are yet to be shared with us. And I think, frankly, it's pretty early, and they're still working on those details. And we also have to put it in the context of our own budget. We don't have those numbers yet either as far as revenue. So was I encouraged that he was asking for and talking about the right things? Yes, but I made no commitment as to what I'm supporting or not supporting at this time. We have a lot of details to work out, and it has to fit into the context of the budget, but we had a good conversation, and we both promised to continue having consultations going forward.
Thank you, Scott. Now to Danny Maxwell from WKOW-TV in Madison. Danny.
Hi, thanks for taking our questions. I was wondering, what are the numbers telling us about the effectiveness of the statewide mask order, if anything yet?
So I certainly will let our epidemiologist weigh in here, but I think one of the things we know about masks is that they do work. There is research now, certainly, that tells us they work, but I also think we have to take into account the period of time it takes for infections to show themselves. And so I think it's probably just a little bit too early to say anything definitively, but we do certainly anticipate it having a positive effect on our case numbers moving forward. I don't know, Traci, you want to say anything more about that?
I think I'll echo what you said, Secretary Palm, and just add, we are starting to see over the past couple weeks a decline in the numbers of cases. And so we really hope that trend is going to continue, and we really appreciate everyone in Wisconsin helping us to keep those numbers headed the right direction by wearing their mask.
Thank you, Danny. Now to Molly Beck from the Milwaukee Journal-Sentinel.
This is Adam. This is Adam Rogan from the Journal-Times. I had an issue with my phone. Can I jump in and ask a question when I missed my spot?
We'll take your question, Adam, and go ahead.
Sorry about that. Thank you. This one should be pretty quick.
Go ahead.
For USPS, does the state have any ability to add funding or resources or take it away, or is that completely based on federal decision making? Thank you.
I can answer that. So I think the question was whether or not the state can support the United States Postal Service, and the answer is no. It's completely federally funded. What we've done to address, the efforts by the Trump administration to cut back service is Governor Evers authorized Attorney General Call to join with over 24 other states to sue the Trump administration over the cutbacks and the impact that can have on the November 3rd election. And we've also continued to urge the president to stop making further cuts and stop making further decisions that hamper the ability of Americans not only to participate in the November 3rd election, but also to receive their prescriptions on a timely basis, be able to receive packages and letters from loved ones on a timely basis, and all of the other things we all rely on the United States Postal Service to do for us.
Thank you, Adam. Now to Molly Beck from the Milwaukee Journal-Sentinel. Molly.
Hi, thanks for having this call again. I'm wondering if you think that there is, with our testing capacity as it is right now, if there's enough testing capacity to accommodate, I would assume, an expected increase in the number of tests after kids go back to school and after college campuses open?
Thanks, Molly. I think one of the things we know more broadly and nationally is there certainly is not enough testing here in Wisconsin or in the nation overall to do it at the level that you would want to do it ideally in a situation like this. Here in Wisconsin, as you know, we have done a lot of work to ramp up our testing capacity since we started down this path in March, and will continue to do that as we move forward. We certainly have prioritized outbreaks in our testing priorities so that we are able to support local public health and others on the ground locally when we see outbreaks. We certainly will want to continue to do that in the context of school, as you suggest, so that we are able, in consultation with local public health, to do what we need to do to be there quickly, to be on the ground, to help stop the spread as quickly as possible so that those outbreaks can be as small as possible. So we will continue to work on both tracks, right? To continue to work to expand our capacity and the diversity of the kind of testing available here in the state of Wisconsin, while we continue to prioritize our ability to quickly help local public health when it comes to outbreaks.
Thank you, Molly. Now to Cammie Rapson from WBAY TV in Green Bay. Cammie. WBAY? Okay, we're going to move on then to Taj Mahal from NBC 15 in Madison. Tajma?
Thank you for taking my question. So FEMA just approved providing unemployed people in Michigan with an extra $300 a week in federal funds. I was wondering if Wisconsin has applied, or is this something possible for unemployed people here?
Yes, we're in the process of considering all options. Frankly, what has hampered our decision-making process, frankly, is that first of all, Congress hasn't done anything yet around this, and then the president's executive order meant one thing one day, and then they added another piece the next day and another piece the next day. So we are in the process of evaluating all options available to us to make sure that, first of all, we have the resources to do whatever we need to do, and/or which one works best for the people that are suffering in our state with unemployment. We hope to be making that decision soon, but at this point in time, we're still evaluating the options available.
Thank you, Tajma. Now to Stephanie Hoff from West Politics. Stephanie?
Thanks for taking the call. My question is for Governor Tony Evers and Secretary Palm. Should Wisconsin Republicans be traveling to North Carolina next week for the DNC or for the RNC? Sorry.
Well, I can't really answer that question directly. All I know is what the right thing is. I have been a participant for the last in the evenings for the last 4 days with the Democratic convention based in Milwaukee, but certainly was a national event. And I'm proud of the fact that the Democrats did it in a way that was safe for the participants, good for the process, and I thought it went extremely, extremely well. And so I'm in no position to judge the people that are going to North Carolina. All I can say is that I'm proud of the fact the level and the state level prioritize safety and health.
Thank you, Stephanie. Now to Aaron Maben from Fox 6 in Milwaukee. Aaron?
Hi there. Thanks for putting this call together. Last night during the DNC, former Vice President Biden talked about a centralized federal strategy for testing, contact tracing, and fighting the coronavirus. Governor Evers Do you think our nation needs this federal strategy, or are you happy with what our state has in place right now?
Oh, right from the beginning, I've said that, and so is, I think, just about every governor in the country. The idea that somehow in an area such as testing or even procuring equipment, that somehow 50 governors get to compete against each other for limited resources when it could be done at the federal level. The president could have and should have used the Defense National Defense Act to mandate industries creating the reagents and to helping us with the testing. If it would have happened right from the get-go, we would be in a better place right now. So do I support it? Yes, I also supported it, frankly, when last February and March, as did most other governors in the state. It's ridiculous for us to be competing with each other for scarce resources when the federal government has the authority and the ability and, frankly, the resources to make it happen in a better way.
Thank you, Aaron. Now to Brian Karen from Fox 11 in Green Bay. Brian?
Hi there. Thank you for the opportunity. What is the single most important measure or statistic that schools should be using when deciding whether it's safe for students to return to class, and why?
So I think you'll see in our the school guidance that the governor referenced in his opening remarks that we provided a consistent but flexible framework. I think it's important to recognize with 422 public school districts in this state, 230 charter schools, and almost 800 private and parochial schools, we have a really diverse and varied array of school buildings, school facilities, geography, COVID disease activity levels, resources, capacity. All of those things need to factor into the way that schools and local public health think about how they move between learning environments and the kinds of things that they deploy to keep their kids as safe as possible. And so our guidance really allows for that kind of specification and local decision making, which you certainly heard in the governor's remarks is our view on the way that our schools are best able to make decisions to keep their kids and their staff as safe as possible.
Thank you, Brian. Now to John Fuller from Spectrum News. John? John Fuller from Spectrum. Okay, we'll move on to Ryan Curry from NBC 26 in Green Bay. Ryan?
Hi, good afternoon. Thank you for taking the call. When you've seen President Trump make a few stops to Wisconsin this summer, but we haven't really seen former Vice President Biden, when you look at the current COVID situation, do you think Wisconsin could be on track to welcoming for an in-person visit later on as Election Day gets closer?
Well, we certainly hope so. I mean, the goal of any campaign and any election is to make sure that people have the data and the information that they need to make good decisions in the election time. And so yes, my immediate issue is doing the right thing around masking, keeping distant, all those things that we know are simple and not controversial will help us open schools this fall, whether it's virtually, hybrid, whatever. That's our concern right now. Yes, it would be great if both candidates from both parties are here in Wisconsin a lot. But I can tell you that at this point in time, bringing hundreds of people together, some of them without masks, sometimes many without masks, is probably not a really good idea.
Thank you, Ryan. Now to Sean Ryan from Milwaukee Business Journal. Sean? Sean Ryan? Okay, moving on to Sean Kirkby from Wisconsin Health News. Sean?
Hi. Thank you for holding this. I was wondering, the 7-day average for new COVID cases has been going down over the last few weeks, but the 7-day positivity rate of test results is going up. I was wondering, how concerning is that trend of increasing percent positives or 7-day average, and what are some of the reasons for that increase? Thank you.
Sure. So both are, of course, very important measures to be watching. And we are watching that case trend to see, the number of new cases we're seeing in real time. Of course, knowing that that data is preliminary and could be changing sort of over the previous 2 weeks, but that's a really important number to watch, and it is declining. The percent positive includes both the positive and the negative, so that number can be influenced by the availability of tests and the number of people who are getting tested as well. So that's some of the reason why they aren't going to always be in perfect alignment, and the percent positivity can vary differently from the number of cases.
Thank you, Sean. Now to Marty Hobie from TMJ4 in Milwaukee. Marty. Marty from TMJ4. Okay, moving on then to Will Cushman from Wiscontext. Will?
Good afternoon. My question is for the governor. It's been a few weeks now since your order for the statewide face mask mandate. And at the time of the order, Republicans in the legislature indicated a willingness to go into session to end the order, but that hasn't happened yet, obviously. And I'm curious if you've heard anything from Republicans in the legislature related to the mask mandate, or if you've had any conversations with them related to the mask mandate since it went into effect, and or if you are still possibly anticipating some action on their part to end the order.
Great question. I haven't heard anything from leaderships around this issue since it was put in place. Obviously, I read what they said to the media, and I haven't heard anything relative to them coming into session. So I guess the answer to that is I don't know. I believe that the masking order is working. It's going well. Obviously, there are some people, and you see it at the recent Pence and Trump events here in Wisconsin, decide not to mask up. But for the most part, I would say the response has been very good, and we feel very confident in its efficacy to drive down the disease.
Thank you, Will. Now to Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you for taking my call. I want to go back to the testing numbers. The daily number of tests was above 15,000 a day. It looked at a rough glance fairly consistently for quite a few weeks. And then early this month, the number started falling below 10,000 a day on many, if not most occasions. You've already alluded, I think Ms. DeSalvo has already alluded to that, was making it maybe more difficult to discern how active the disease is. And I'm wondering if we can break down a little bit more what's going on here. Is there fewer people just showing up? Are there still the issues of supply disruptions? And if there are any particular places around this state where it's most serious and prospects for improving on that?
Yeah, it's a great question, Eric. I think we are still asking some of those questions ourselves. I think, and I think there are a number of factors at play. Some of it is related to testing demand. As we've seen the daily case numbers subside, as Traci suggested, that certainly could be impacting demand for testing. I think there is concern certainly about supply of tests in this state and around the nation, as we have heard these anecdotes about diversion of our resources to other places. And so I think folks are, providers and labs and other parts of the system are worried about whether they'll be next on the list, the diversion list. And so that could be impacting our daily testing numbers. But broadly speaking, we need to continue to expand our capacity here in Wisconsin. We need to make sure we're continuing to diversify the kind of tests that are available to the people of the state of Wisconsin. And if you have symptoms or you are notified by local public health that you are a close contact to a positive case, you should get tested. And there are tests available. We do have capacity, and so we would continue to encourage people who need a test to get a test.
Thank you, Eric. Now to Brittany Lewis from CBS 58 Milwaukee. Brittany.
Good afternoon. We were just wondering if you guys are concerned about a spike in cases during flu season and how you're preparing for that.
Yeah, it is a great question, and I would first and foremost encourage everyone to get a flu vaccine. As soon as they're available through your provider, get a flu vaccine, because it will help us certainly understand and sort out, right? Because the flu and COVID have similar symptoms, the more people who get vaccinated for flu, the lower their draw on the healthcare system will be, because there will be less flu disease circulating. But it'll also help us tell more quickly flu from COVID when it walks through the door, right? Because the better we are at vaccinating from the flu, the more likely what's left then is somebody with COVID. So we want to do everything we can. We want to raise awareness. We want to encourage as many people as possible to get vaccinated for flu as soon as possible, so that we are really able to spend our resources and our focus on COVID-19 this fall as we're moving through the school year and into the winter.
I just add, I'm going to echo that getting your flu vaccine early is a really important thing to do, but continuing to do things like wearing your mask, practicing good physical distancing, washing your hands, these are also things that can help to prevent flu in addition to COVID. So continuing to do those good practices can help to keep you from getting those and other respiratory illnesses this fall and winter.
Thank you.
Thank you, Brittany. We have time to go back to those who we called on and were unavailable earlier, so we'll try again with Cammie Rapson from WBAY TV in Green Bay. Cammie? Okay, no Cammie. Moving on then to John Fuller from Spectrum News. John. John Ryan from Milwaukee Business Journal. And finally, Marty Hobie from TMJ4 in Milwaukee. Marty? Okay, then that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a good afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.